Hi, thanks for joining me today. My name is Sean Egglestone and I'm a registered dietitian. And today I'm going to be going over my presentation on diabetes. Before we get into nutrition and diabetes, let's go over some interesting facts. So this is new for 2020. About 10% of Americans have diabetes, so 34 million, very, very common disease. But only about 1.25 million children and adults have type 1 diabetes, so the vast majority of people with diabetes is type 2, and we'll talk about the difference in the next slide. In the next 25 years, it's estimated that up to 33% of people will have diabetes in America. And this is important because not only is it a serious issue for our health and for our healthcare system, but it's going to continue to be an even bigger problem later in the century. Now, 50% of people with diabetes are on insulin therapy after 10 years, and this is important because insulin can actually make your diabetes worse by promoting weight gain. Now, diabetes itself doesn't kill people. No one dies from diabetes. What they die from is the complications of diabetes, which is heart disease and stroke. Diabetes is the #1 cause of kidney failure, blindness in working-aged Americans, and limb amputation outside of wartime. So aside from just heart attack and stroke, there's also end-stage renal disease and dialysis, blindness, retinopathy, limb amputation, peripheral vascular disease. So these are some serious issues that you could face if you don't control your diabetes. Now, for 2020, the National Diabetes Statistics report 88 million Americans have prediabetes. Many do not know they even have it, so that's why it's important that you get your hemoglobin A1C checked at your doctor's visit so that you can address this issue if you do have prediabetes. It's much easier to reverse prediabetes than it is type 2 full-blown diabetes. Now, gestational diabetes, that's what affects pregnant women. And this is an issue because if you have gestational diabetes, it increases your risk for developing type 2 diabetes after pregnancy. So some key definitions. Insulin is a hormone that's produced in your pancreas, and it's essential for glucose absorption or sugar absorption. So in the next slide, we'll actually go over how insulin works. But just keep that in mind that your body produces a hormone called insulin, and it's very important for you to use your blood sugar. And when your body doesn't respond well to insulin, that's why we see all these issues with diabetes. Now, type 1 diabetes, as I mentioned earlier, is an autoimmune disorder, and it typically is diagnosed under 10 but can be as late as 20. It's a condition where your body attacks the insulin-producing cells in your pancreas, and it's a different mechanism than type 2 diabetes. Type 2 diabetes is caused by impaired insulin sensitivity as well as insulin production, but that's because it's not so much your immune system attacking your pancreas, but more about fat and how fat can be toxic to your pancreas, and we'll talk about that in a few slides as well. Oftentimes the treatment, we're just going to flip back and forth here. The treatment for type 1 diabetes is insulin. It's always going to be insulin. You have to check your blood sugars, control them, maintain your weight, eat well, exercise, and of course take your insulin as prescribed. With type 2 diabetes, not everyone with type 2 diabetes is on insulin. Some people are just on metformin or other pills that you can take. But diet is the primary way that we should be addressing type 2 diabetes. Now, there's this term, hemoglobin A1C. That's a test that your doctor can do, and it is a 3-month average of your blood sugars. So what you want to see is a normal range of 4.5 to 5.6. Now, if you're 5.7 to 6.4, that's what we call prediabetes. So if you've ever heard of the term prediabetes or I have prediabetes, it just means that their 3-month blood sugar average is elevated. Now you can go on Google and type in hemoglobin A1C to blood sugar average, and that'll give you a nice little graph. So you could say, well, an A1C of 6.5 is roughly an average blood sugar of 140. Now, unfortunately, these graphs are highly variable depending on which one you look at, so I'm just giving you a generic number. If you've ever been in the hospital or had your finger pricked where they check your blood sugar, they might give you a value of 100 or 200 or 300. So that's just what your blood sugar is this very instance, but your A1C is the 3-month average. Diet-controlled diabetes just means that people usually have prediabetes, or maybe they have diabetes, but they're managing their blood sugars fairly well with diet alone, and they don't need medication. And gestational diabetes is diabetes during pregnancy. So let's talk really quickly on how insulin works. So when we eat foods that are high in carbohydrates, such as fruits, some vegetables, beans, as well as starches like rice and oatmeal and pasta, snack foods, chips, crackers, cookies, pastries, sodas, and other sugar-laden beverages. That sugar, or those carbohydrates I should say, break down into sugar in our intestines. That sugar enters our bloodstream, and in order for our body to use that blood sugar, it needs insulin. So in order for your muscles to take in the sugar and use it, you need to have a hormone called insulin. So in type 1 diabetes, your immune system attacks your pancreas. That's that little yellow, weird-shaped organ here on the right. So when your pancreas doesn't work and it's not producing insulin, then the sugar just goes around and around and around, and it doesn't get absorbed. And so that's why people with type 1 diabetes will have to take insulin. But with type 2 diabetes, it's a combination of a few different things, which we'll go over in the next slide. So just keep in mind, carbohydrates turn to sugar, and your body needs insulin in order for that sugar to be used appropriately. So why do we get diabetes? Insulin-dependent diabetes, or type 1 diabetes, or sometimes called childhood diabetes. They're not entirely sure. It could be viral. There is some thinking that it could be caused by a premature exposure to dairy. And so when our body is prematurely exposed to the proteins that are found in cow's milk, our body will form antibodies against those proteins. And there's a 13 amino acid sequence, and it resembles the beta cells in our pancreas that produce insulin. So when your body's trying to fight off this protein from dairy that it doesn't really know, it's not familiar with, unfortunately your body also starts attacking your pancreas. That's one thought, but we're not entirely sure. Family history or genetics, you'll often hear, well, my dad's got diabetes, my mom's got diabetes, my brother, my sister, my aunt, my uncle have diabetes. You grew up with your brothers and sisters eating the same stuff which your parents ate, which may have been what their parents ate, and so similar lifestyles and diet patterns run in families. Another issue is lack of exercise and stress. So when we don't exercise and move our body and we have stress, our blood sugars won't be used as effectively. There's some surgeries that can cause diabetes, but that's not the focus of this presentation today. The real focus here is poor diet reduces your insulin production and decreases your insulin sensitivity. That is why people get diabetes. Let's dive in and take a look about what that means. So please, please, please don't be intimidated. This is the most complicated slide that we'll have in the presentation today, and I'm going to break it down really, really simple for you. So this is what we call the twin cycle hypothesis. So there's two issues why people are getting diabetes. When we have a positive calorie balance over a long period of time, meaning when we eat more calories than we should and we're snacking late at night and having the food that we shouldn't be eating, we tend to gain weight. Now some of that weight will be around our hips, our butt, our thighs, our arms, our chest, our back. But some of that fat will build up inside of our organs, specifically our liver, our pancreas, and our muscles. Our liver is responsible for producing some blood sugar. So your liver doesn't turn off when it should. It doesn't stop producing that sugar. So when there's fat in the liver, the liver just starts pumping out more and more sugar and doesn't stop. Fat also builds up in the pancreas. The pancreas is responsible for producing insulin that we talked about in the previous slide. Now, fat is toxic to the pancreas. It kills the pancreas. And this is important because that means that our body stops producing insulin. Now, people typically don't clinically show signs of diabetes until at least 50% of the insulin-producing cells in the pancreas are dead. Now, the thinking is that fat can put those cells to sleep and that some of them can wake up, or they can just die off altogether. So when we have fat, small amounts of fat, we're talking 1 to 2 grams, very small amounts of fat that build up in our organs, it causes our body to produce way too much blood sugar, and it impairs our ability to produce the hormone insulin, so now we can't manage those sugars appropriately. This is the twin cycle. Now, to complicate matters even more, fat can build up inside our muscles, which makes our muscles resistant to the hormone insulin. So our body's not producing enough insulin, and now that insulin's not even working. And that's what we see right here. This is a cross-section of a muscle cell. So those green little dots that we see on the left-hand side, those are tiny microscopic fat drops inside of our muscle cells. That fat that our body, that fat that we develop around our abdomen spills over into our muscles, and that fat impairs how our muscles use insulin, and that's really where most of the blood sugar goes. Most of your blood sugar goes to your muscles. Well, now the muscles aren't letting that blood sugar in. Another reason why we know this is because about 84%, they did this study, about 84% of people who underwent gastric bypass surgery completely reversed their type 2 diabetes within a matter of days before any weight loss occurred. So this goes to show that our body is able to mobilize the fat out of our liver, out of our pancreas, and out of our muscles really quickly, much quicker than we can lose weight around our middle section. So it's not about how much intra-abdominal fat you have or how overweight you are. It's about how much fat is inside your muscles, your pancreas, and your liver. And that's why we can see people who are not overweight, but they have type 2 diabetes. It's because their body is storing fat inside of their organs more readily than other people. On the other end, I've seen people that are 500 pounds that don't have diabetes. This shows that, well, while they're storing fat, they are not storing fat inside of their pancreas, their liver, or their muscles in sufficient quantities to cause diabetes. So the real question is, can diabetes be cured? Now, the Mayo Clinic says there's no cure for type 2 diabetes, but you are able to manage these conditions. The Joslin Diabetes Center says there's no cure for diabetes. Neither type 1 nor type 2 diabetes ever goes away. But we just saw on the last slide that 84% of people in this study that had diabetes got off their medications, were able to control their blood sugars, and for all clinical purposes, didn't have diabetes. I've personally seen people that have gone from an A1C of 14 to an A1C of 5 or 6 and are not on any medications and are completely able to manage their blood sugars with diet alone. I heard this one quote from someone that says, "You always have diabetes even if your A1C is normal." That's like saying you're still overweight even if you lose the weight. Like, no, you're not overweight if you lose the weight. The same way that if you're off your diabetic medications and your A1C is between 4.5 and 5.6, you're not diabetic anymore. Now, you might be at a higher risk for developing diabetes again, but from my professional opinion, you do not have diabetes. Diabetes.org says type 2 diabetes remission can occur in people who have not had weight loss surgery, but it's very, very rare. Now, what we do know is that a lot of these places are getting funding from pharmaceutical companies that produce insulin. And so I believe that there's a lot of bias in the industry currently because there's a lot of money to be made if people don't think they can reverse their diabetes. Now, am I saying that you can cure your diabetes? No, not necessarily. What I'm saying is if you're very, very aggressive at diet and lifestyle interventions, modifications, you may be able to get off your diabetic medications or reduce them substantially. But you need to do so under the supervision of a physician, and it takes a lot of time and energy, but I've seen people significantly improve their diabetes and even become non-diabetic, but it's rare because most people aren't prepared to put in the time and the effort to really see if it's possible. Of course, how long you've been on insulin, how long you've had diabetes, and, well, how damaged your pancreas is will all play an important role in whether you can get off your diabetic medications or not. Now, how do we prevent or improve our diabetes? Nutrition is the most important thing, okay? So, the Harvard School of Public Health says that 90% of diabetes can be prevented. We do know that movement, some people call it exercise, I call it movement because you don't need a gym necessarily. 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity a week is the current recommendation from the Health and Human Services. Although more can be better, I've seen studies that show as much as 90 minutes a day of moderate activity, you'll continue to see a benefit. So this 150 minutes a week, I mean, that's only 20 to 25 minutes a day. But if you increase that to 60 or even 90 minutes of exercise a day, you'll see even better improvements in your blood sugar, your weight loss, and of course with the weight loss will come even better blood sugar control. Stress reduction is important. If people are stressed out, then their blood sugars tend to go up as well. Don't smoke and abstain from alcohol. Let's recap really quick. We've gone over some important terms: type 1 diabetes, type 2 diabetes, insulin, hemoglobin A1C. We've looked at how carbohydrates are digested and how insulin works in the body to allow your muscles and your organs to take up glucose or take up sugar. We've looked at the twin cycles hypothesis, which shows that fat buildup in the liver, pancreas, and muscles causes our body to produce way too much sugar, kills off the cells that produce the hormone insulin, and impairs our sensitivity to insulin, specifically at the level of the muscle cell. And we've looked at some current advice and some studies that have shown that indeed people can become non-diabetic. So what the heck are you supposed to eat? That's what everyone wants to know. So let's tackle this issue. So there's a lot of different diets out there: South Beach, Paleo, Vegetarian Atkins, Weight Watchers. Now we'll talk about which one I think is the best here coming up, but all credible diets or cookbooks will always have something in common. They'll all focus on whole foods: fruits, vegetables, whole grains, nuts and seeds, lean skinless meat, and low-fat or fat-free dairy. None of these diets are recommending processed junk food, chips, crackers, cookies, soda. And so you could take the worst diet in the world, which is, from my opinion, the ketogenic diet. People have better blood sugar control and lose weight on the ketogenic diet, not because it's healthy, but because they're not eating as bad as they normally do. So a lot of diets will work for a lot of people because they're eating better, but that doesn't mean that all diets are as effective in improving your blood sugar control. Now, one of the most important things to look at with diets is the ratio of animal foods to plant foods. You want to have the majority of your diet plant foods. I have another video on my website about heart healthy eating as well as heart healthy shopping and cooking, and another one on carbohydrates that will dive into what you're supposed to eat in even more detail than what we'll cover today. So if you want to learn more, you can hop on over there, SeanTheRD.com, and check out some of those other videos. But you really want to look at the produce or the plant food to animal food ratio. You want to have at least 75% of your food plant foods, fruits, vegetables, whole grains, beans, nuts, and seeds, and no more than 25% of your food to come from animal sources. There's no secret pill, there's no superfood, powder, medication, or temporary fix. And that's what a lot of people are looking for, is these quick fixes. This is about a lifestyle change. This is about a long-term, lifetime commitment to eating a diet centered around whole plant foods. So again, I have more videos that go over this in detail, but let's talk about the important stuff here. Grocery shopping. Whole foods, minimal ingredients. You want to look at that ingredient label. I don't want to see a long list. You can get your fruits, you can get your vegetables, you can get a bag of brown rice, you can get oatmeal, you can go to the bulk bin section and get a whole bunch of grains. But I don't want to see frozen meals, Jimmy Dean breakfast bowls, frozen burritos and pizzas, and a whole host of most of the stuff in the grocery store is just garbage. It's got more than one ingredient. So if you go shopping with me and you look at what I buy versus what other people buy, what you find is that I buy individual ingredients. I go home and I cook and make a meal, whereas most other people buy foods that come from a food manufacturer. So think of it like if you were to go to a farmer's market or a farm. What would you see there? You might see some meat, but you'll certainly see fruits, vegetables, whole grains. That's the center of your diet. You want to look for foods that have little to no added salt. So I look for less than 300 milligrams per serving on the label for sodium. Of course, the lower the better. 100 is better than 300. You want to move away from solid fat such as coconut oil and butter and move towards olive oil, but you definitely want to use it very, very sparingly, if at all. You want your fats to come from nuts, seeds, avocados, beans, whole foods where the fat originated from, not these liquid fats that were extracted from fruits and vegetables. And I have another presentation on fat on my website under presentations that you can check out with more information on that. Cooking and eating. So you want half your plate to be vegetables. You want to have some fruit. So 75% of your plate should be plant foods. Fruits, vegetables, whole grains, rice, oatmeal, that kind of stuff. And that will make sure that your diet is centered around whole plant foods. Drink mostly water. Definitely cut out any kind of liquid sugar, or what I call liquid sugar, but sodas and other drinks with added sugar. Sometimes people will say, what about diet soda? Look, if you're committed to not having diabetes and you're committed to health and overall high quality of life, there's no room for diet soda. Okay, diet soda is not healthy. It can increase your risk for kidney stones. So when I make recommendations, it's not just about diabetes, it's about your overall health in general as well. You can use nonstick pans, whole grains in replace of white flour and these floured products, using spices and herbs instead of salt. And when I bake, so baking generally is pretty unhealthy, but if you do bake, I cut the fat in half, I cut the salt in half, and I modify recipes that way as well. So this slide's a little funky looking, but if you go to Google and you type in Dr. Greger's Daily Dozen PDF, you'll come up with a PDF that looks very similar to this. This ensures that your diet is centered around whole, intact plant foods. You want to have beans every single day, 3 servings. You want to have berries. They're high in antioxidants and reduce your risk for cancer. You want to have other fruit. So here we have 4 servings of fruit per day. You want to have 5 servings of vegetables per day, including greens like kale and salad greens and spinach, as well as cruciferous vegetables such as kale, broccoli, cauliflower, cabbage. Those will reduce your risk for colon cancer. You want to have some ground flaxseed every day. These will provide you with heart-healthy fats without the added oils. You want to have some whole nuts. Those are going to have things like selenium and zinc and magnesium, these important minerals that are great for your overall health. some spices like turmeric and ginger that will reduce inflammation. You want to have 3 servings of whole grains. Like, you could do whole wheat bread, but if you have really bad diabetes or you're looking to improve your blood sugars as best as possible, I would stay away from any product that's made from flour, including whole wheat flour, and just switch to intact grains such as millet and farro and barley and oatmeal and brown rice. Those will digest the slowest compared to their floured relatives, if you will. And then, of course, you want your beverages to be water or tea or coffee. This is another visual example of what your plate should look like. So here on the bottom section, half our plate is vegetables. We have a side of fruit. We have a quarter of our plate is some kind of starch, quinoa, barley, pasta, millet, rice, sweet potatoes. And then for the protein section, you want to have beans every day because beans will actually help lower your blood sugars. They have something called the second meal effect. So they help lower your blood sugars for 8 hours. So I try and have beans every day for lunch. This helps keep my blood sugars low at lunch and at dinner. So replacing your chicken and your fish and your eggs and your beef with things like tofu and beans and lentils will improve your overall health as well as your diabetes. And again, using that checklist, you want to have 6 to 8 servings minimum of fruits and vegetables daily. And this is why I always cringe when I hear people that only have 1 meal a day or only 2 meals a day. Because if you're only eating twice a day, how are you getting 6, 8, 9, 10 servings of fruits and vegetables a day? You're not. And I can consume 15, up to 15 or even as high as 20 servings of fruits and vegetables a day when I'm having smoothies. So you want a diet that's centered around whole plant foods. Yes, they have carbohydrates. Yes, these carbohydrates are going to turn into sugar, but they're going to do so very, very slowly because they have fiber in them, especially your vegetables. Fruit is not associated with an increased risk of diabetes. They don't show that people who eat more fruit that have diabetes have worse hemoglobin A1Cs because fruit is only 300 calories a pound. So people that tend to eat more fruit will eat less junk food, snack food, and other foods that are really high in calories. Even chicken is 1,000 calories a pound compared to fruit being 300 calories a pound. So having a diet that's centered around whole plant foods, even though it's a diet centered around carbohydrates, will improve your diabetes in the long term. This is another example. If you go to my website, SeanTheRD.com, under recommended resources, you'll see Dietary Guideline for Americans 2015 to 2020. That is an absolute must read if you're interested in reducing your risk for diabetes or improving your blood sugars. So they're showing again 3 to 4 cups of vegetables a day, okay? 1 serving of vegetables at dinner is not going to cut it, guys. 1 piece of fruit, 2 pieces of fruit, not going to cut it. You need to have a ton of fruit, a ton of vegetables, whole grains. Now here we have some dairy, and that's because the dairy industry seems to still have a huge lobbying influence. But if you don't have any dairy at all, that's fine. Just make sure you have some kind of calcium substitute, whether it's almond milk, soy milk, hemp milk, or these dairy alternative yogurts. There are other beverages out there that are fortified with calcium, so you want to make sure you have 2 to 3 of those a day if you're not having dairy. So what this shows is 21 to 28 cups per week or 3 to 4 cups daily of fruits and vegetables. Very, very important. Again, I'm not going to go into detail on all of these slides because I have 2 other presentations that go over calorie density, nutrient density, volumetrics. But what this shows is that oil, cheese, and meat are very high in calories for the amount of space that they take up in your stomach. So when we look at people around the world that have the lowest risk of diabetes, the lowest risk of heart disease, and the best overall health picture long term, they have a diet that's centered around fruits, vegetables, and whole grains. They have a little bit of meat, maybe a little bit of dairy, not much oils, but they have a diet centered around plant foods and it's complemented with animal products and oils, but those do not make up the majority of their food. Now, when you look at people such as in Europe and other countries that are developing diabetes very quickly, America, South America, they have a diet that's centered around dairy, meat, added oils, refined white grains. And this is why a lot of people, combined with poor exercise and stress, develop diabetes. Forks Over Knives is a great website. They also have a ton of recipes. So if you're looking, I actually just spoke with a guy the other day. He was on the Forks Over Knives diet for a few years, and he got off of his cholesterol medication. He got off of his blood pressure medication. He lost a ton of weight. Am I saying that everyone's going to have those same results? Maybe, maybe not. Of course, you don't want to get off your medications again without the direct supervision of your physician. But I have seen people that have been on the Forks Over Knives diet that report tremendous benefit. And of course, if you go on over to the website, they'll have a ton of personal testimonies as well. This is just another example of the slide we saw earlier with the stomach. It just goes to show that vegetables, fruits, grains, beans, these are very low in calories. 500, 550 calories per pound or less. When we get into chicken and fish and meat, about 1,000 calories a pound. We get into junk food, snack foods, chips, crackers, cookies, desserts. Now we're looking at 1,500 to 2,500 calories a pound. And then, of course, oil. Any diet, especially like the ketogenic diet that emphasizes oils, added fats, cream, those are going to be very high in calories, very low in nutrition. So where do we go from here? How can we make improvements as a community, as Americans? We need to start screening for diabetes earlier. If you don't know what your hemoglobin A1C is, you need to get it checked. You need to know what that value is. It's much easier to reverse prediabetes than it is diabetes, and you can prevent diabetes altogether if you act aggressively with diet and lifestyle intervention now than when you've already had diabetes. If you remember at the beginning of the presentation, there's a staggering number of Americans that don't even know they have prediabetes or that they even have diabetes. So getting tested and knowing what your A1C is very, very important. Healthy nutrition won't happen overnight, but it needs to happen for the rest of your life. This is a long-term lifetime commitment, not a 3-month fix. You need to create a lifestyle or culture around health, around nutrition. So you're going to need to change your home. You need to change your kitchen. You need to throw out all the junk food. You need to get your family members on board. So if you're trying to get healthier, but you live in an environment where everyone is trying to keep you sick, it's going to be much more difficult for you. Especially if you have the habit of going out to breakfast with your buddies a few times a week in the morning, or you tend to go out to dinner with your group of friends every Monday night, for example. You're going to have to start bringing your food and changing where you eat and changing who you hang out with so that you can create an environment around yourself that constantly promotes health. Breastfeeding decreases your risk for diabetes for you and potentially for your baby. So please try and breastfeed. See a dietitian that specializes in breastfeeding. They can help you tremendously with that. You can't eat what you don't buy, so don't buy the bad stuff and bring it home. Move your body in a way that you enjoy. So remember, 30 minutes is good, 60 minutes is great, 90 minutes of moderate activity a day is even better. If you need to see a physical therapist, if you need to get cleared by your doctor, if you're not safe or steady on your feet, please get evaluated. You don't want to just jump into an exercise routine. Make sure you get cleared from a health standpoint that this is something that you can do without any adverse complications. We need to have authoritative sources on nutrition and giving out recommendations that aren't biased and aren't influenced by the manufacturers of insulin and the pharmaceutical companies. Go see a registered dietitian. Don't see a nutritionist. Nutritionists are not registered dietitians. Anybody can call themselves a nutritionist. but a registered dietitian has education and internships and continuing education and exams they have to take. For example, I've seen about 15,000 patients, so I stay very, very busy and I'm on top of the most current nutrition information. You want someone that has dedicated their life to nutrition and that this is a career for them, not a hobby. Losing 5 to 10% of your current weight can significantly improve your blood sugar and insulin levels. Why? Because that weight can help remove some of that extra fat inside of your muscles and your organs. Remember, half your plate vegetables, you want a fruit, you want some starch, you want some protein, focusing on beans and lentils, small frequent meals. When you eat desserts, enjoy them. Healthy nutrition doesn't have to suck. This shouldn't be torture for you. You need to enjoy the process. You need to enjoy the diet. And I think when people follow a diet that's centered around whole plant foods, such as the ones that you'll see on Forks Over Knives, nutritionfacts.org, and some of these other sites, what we find is that people see dramatic improvements in their health, and it's those improvements that help motivate them to continue on with a diet centered on whole plant foods. Drinking smoothies, especially smoothies that have a ton of vegetables, and sipping on them slowly can help you increase your produce intake, and they can help crowd out, if you will, some other bad foods in your diet. Have patience and compassion. This doesn't happen overnight. This isn't torture. And you can't live a life where you blame yourself. You have to blame the food. And when you blame the food, then you can start to make choices that will help propel you in a positive direction. Never give up and set small tasks that are easily obtainable every day. Thank you again for joining me. I hope you found this presentation helpful. If you haven't gone over to my website, SeanTheRD.com, and taken a look at some of my other presentations, recommended resources, and recipes pages, there's a ton of information on my website that can help direct you to the right way to eat, the healthy way to eat that's backed by science. Thanks so much for watching. If you have any questions, you can also go on to my Contact Me page and send me a message. I'll be more than happy to get back to you. Thanks again.